Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Island families. We hope you enjoy this evening's edition.
Good evening. Welcome to this edition of Labor Vision. My name is Jim Riley. I'll be your host this evening. We continue to see hospital systems in Rhode Island forming large corporate networks, including for-profit companies whose bottom line is not improving patient care or respecting their workers. Today we are focusing on the pension at Fatima Hospital being dramatically cut, what the United Nurses and Allied Professionals is doing to address their concern on safe staffing, and then finally, thoughts on the closing of Memorial Hospital. My guests today are Linda McDonald, RN and President of the United Nurses and Allied Professionals, or UNAP, and Lynn Blaze, RN and President of UNAP Local 510 at Fatima Hospital. Linda, tell us about UNAP, United Nurses and Allied Professionals.
Thanks, Jim. Thanks for having us on Labor Vision today. The UNAP represents a little over 7,000 RNs and other allied professionals in Rhode Island and Vermont. We represent members in 6 of the acute care hospitals in Rhode Island. And we are proud to say that we're an independent healthcare union and that the issues that are before us as union members today have never been more difficult.
Lynn, you're an RN at Fatima Hospital. Tell us how your members are coping with having their pension drastically cut last year, and explain to our viewers how that happened.
Well, what happened, Jim, is in August of last year, 2017, we were notified that our pension was going into receivership. It was the first time we had any notification that there was problems within the pension system. That pension has been in place since 1965. It's a church-based pension plan, so it's not covered by any of the regulations in the federal government, not covered under ERISA, or have to meet any of the requirements of reporting out what's going on with the pension to its members. So we had 2,700 members of the pension system. Some are union members, some are non-union members, who are facing a 40% cut in their monthly pension benefits. And that is probably the most devastating thing I have encountered as a local leader. Listening to people and the hardships that they're going to have to encounter if they lose 40% of their income. Where are they going to live? Are they going to be able to have their meds? Are they going to be able to buy their foods and survive in not the lap of luxury? I mean, we're talking about people who are just getting by, a lot of them. This is not a pension worth thousands and thousands and thousands of dollars a month. You're talking about people that are getting a pension of anywhere from $500 to $1,800 a month, and you take 40% away, it's devastating.
Yeah. So now you're mired in court fighting several adversaries. Where do you stand right now?
The court system is grinding along, and it's a difficult grind. It's difficult to wait, not knowing what the outcome's going to be. We're very pleased with the receiver, Stephen Del Sesto, and Max Wisto, the special investigator. They are digging deep. They're doing the best they can to get the information they need from both St. Joseph's Health Services of Rhode Island as well as the Bishop. And it's disturbing to see the roadblocks that get put up. Every time you ask for more and more information, there's more and more excuses of why they can't provide that information. Just as recently as last week, we found through the court documents a report that was made in March of 2014 by the administrators of that hospital that showed that this pension was going to fail, that once they made the investment of $14 million, that if they put no more money into that fund, that fund would fail by 2034. We learned that last week through the court systems. Never once did the hospital system, the Bishop, come forward to any of our members to tell us that this pension was going to fail.
You mentioned that it's basically a church pension, and it's not covered by ERISA laws and protection acts that have been passed protecting pensions. And you learned about this when the damage had already been irreparably done. Don't you think that the bishop has a moral obligation to treat his employees, which in essence you are, with more transparency?
Absolutely. He needs to be out front. He needs to be honest. Anytime we see his reports, it just creates more anger within the pensioners, because they see what he's doing is outright lying, that they received a pension when they started working for that organization with a letter signed by whoever the current bishop was to say this is what your pension is, and this is a church-based pension, and the church stands behind this pension. And now he's trying to distance himself as far as possible from it. And if he wanted to be out of the hospital business, as he says, we've been out of the hospital business for years, then that pension should have been converted into an ERISA pension.
Absolutely.
And been protected. And that would have been the right thing to do and the moral thing to do. But hiding, and it's guilt by omission, that you knew these things were going to happen, and you're guilty because you did not inform those of us that are going to receive that pension that these problems were coming.
Sounds like the bishop should give confession to you.
Absolutely.
Okay. Linda, pivoting off the pension case to patient care, you have a bill in the General Assembly as we speak for this year. It's called the Patient Safety Act. Can you tell us about that? Sounds like something everybody should be in favor of.
Well, we think so. This is our third or fourth year putting this bill in. For many years, we have seen staffing levels, meaning the number of patients that an RN treats at one time, becoming unmanageable. And as you mentioned earlier, the bottom line seems to be the focus, but the bottom line never is to give the RNs enough nurses in order to take care of patients safely. So this bill, which follows the Mass Nurses Association bill, sets a safe patient limit that a registered nurse can take care of in one shift or at one time. And we are following this. We have sponsors. We will be working at this until we are able to say that a nurse on this shift taking care of these patients can only handle X number of patients.
It seems odd for me as a layperson not to assume for a moment that laws like that would already be in place. We're talking about patient care, people coming to hospitals. They got sicknesses, they got problems, they're having operations. Wouldn't you have some sort of a setup where, I know years ago they had what's called DRGs, domestic, something regulated groups,
right,
that determined how long an individual would be in the hospital. It
right,
sounded like they were just trying to move people in and out, and the care piece was missing. People want to know that when they go to a hospital, any hospital, that they're going to get great care, and there's going to be enough people to care for them, and that they're going to be there for the amount of time that they need to be there before they get sent home. And it just doesn't make any sense to me that there wouldn't be any. How's that bill moving through? I mean, I know we just legislator just had their first session a couple of weeks ago, and I think. How do you feel? What do you think was going to happen with that bill?
Well, we feel when we introduced the no mandatory overtime bill, it took us almost 8 years to pass it. So each year is a little more education for our legislators. There's more and more interest. We are seeing the numbers at the bedside increasing. One of our larger hospitals, we just heard, there are 8 or 9 patients for one registered nurse, and so there are no regulations. We are joining states, Connecticut, New York, New Jersey, Pennsylvania, Rhode Island, Massachusetts, and everybody, all these states are putting in laws to regulate how many patients a nurse should safely take care of at one time. Just as airplane pilots, just as teachers, there are many areas where there are regulations which only make sense, and we are going to be back at the State House until we pass this.
Lynn, you're at Fatima. Your nurses are going to be directly affected by this bill. What are you guys doing to get involved in this sort of activity? Are you involved in some of the lobbying process, talking to some of your elected officials and helping out with that with the program?
Oh, absolutely. We do a lobbying day where we get our members down to the State House to go and talk directly to their legislators and tell them the importance of this bill. As someone that works in a for-profit hospital, this legislation is more important today than it ever has been, because for-profit and healthcare do not mix. You need to have laws that regulate how many nurses it takes to care for X number of patients. And if it's up to the hospitals, less is more in their minds. They get more money if they put less nurses on the floor.
Now, we know that healthcare facilities are primarily a 3-shift business, 7 to 3, 3 to 11, 11 to 7. You say you have a lobby day. How many nurses or other professionals or even non-professionals do you bring to the State House for that lobbying day? I say that because I've seen lobbying days on behalf of at the State House, both in Massachusetts and in Rhode Island, where there have literally been hundreds and hundreds of individuals in certain industries. And it's a really, really affecting visual when you see that, and it makes the elected officials really think about. So how do you go about putting together a really successful lobbying day?
Well, a successful lobbying day, we first educate our members, starting now, about the bill, and then we build up to a lobby day. We find, you are correct, that it is very effective to do that. So in one lobby day, we may bring over 100 of our members in at one time. There are other times when we have bigger demonstrations, but to actually go in and talk to the legislators, we bring in about 100 of our members at a time. We also collect thousands of postcards, which we send to our legislators, that we have people sign, our members sign, all over this state. So we also do that.
Now, you've got nurses and members from all over the state. Do you send in, for UNAP, not just Fatima, but all of you who are in this collective group, would you send like some folks from Charleston to see their elected official, and folks from Cranston to see their elected officials, to really drive it home?
That's exactly what we do.
Yeah.
The most effective thing you can do is talk to your legislator. That's who they listen to. You're their constituent. So we definitely pair up our members with their own legislators.
Terrific. Care New England bought Memorial Hospital 2013, I believe it was, and they have recently closed that facility, dispersing hundreds of workers, both union and non-union. It's a really sad story. What is the status of those workers, and how will they affect patient safety with only one hospital landmark in the Blackstone Valley?
I think talking about Memorial is, we saw the systematic dismantling of this hospital since Care New England took over the hospital, and we saw different units closing throughout the last few years, until a point where patient census was down so much that the closing of it was inevitable. We have about only about 15 to 20 UNAP members that will be left at Memorial Hospital in some outpatient capacity. As you know, UNAP had to file a lawsuit in order to get Care New England to the table to even discuss this. And so, yes, it is a tragedy for nurses who have worked at Memorial for 30 and 40 years to now be looking for other positions, but it's more a tragedy for the patients who rely on this small community hospital for their care. And that is where the UNAP has its focus on getting a commitment from Care New England. How are you going to service this population, and where are they going to go?
Once again, we opened the program talking about these large corporations and large companies coming into the healthcare industry. They may not know much about it. You know more about the healthcare industry than any corporate executive that there could ever be, because of all the experience that you have at the bedsides of sick individuals. But they're more interested in the corporate graphs than they are. They're not. Are they? Do they listen to you when you talk to them?
We force them to listen.
Good.
And that's our job, and that's what we feel our job is to hold them accountable to the patients that we serve. And we will do that till our dying day.
Yeah.
And the UNAP has been very successful in either organizing or bringing our employers to the table to discuss these issues.
Well, I want to first of all thank you both for the great work that you do.
Thank
Linda,
you for
I've known
having
you
us.
for many years. Just met you recently, and you're the front line for patient care in the state of Rhode Island, and you do a terrific job. Thank you for watching this edition of Labor Vision. We'll see you next time. Good afternoon, and welcome to this edition of Labor Vision. I'm Jim Riley. I'll be your host today, and I am delighted to have as my guest the leader of the working families here in Rhode Island, George Nee, president of the Rhode Island AFL-CIO. Delighted to have you here today, brother.
Great to be here, Jim, and thank you for all you have been doing and have done in the labor movement, and this is a new role for you, and I think you're going to do great.
Gee, I hope to do a lot more. George, it's been an interesting year. We're getting to the end of 2017. It's been an interesting year nationally and an interesting year locally. Do you think you can give us a recap of 2017 from a labor perspective?
It's been an encouraging year. There has been some significant organizing victories. There have been some contracts achieved. For example, Local 26, who after a long fight with the Renaissance Hotel in Providence, achieved their first collective bargaining agreement. The UNAP union, United Nurses and Allied Professionals, both got a new contract for about 400 new workers that organized at Kent County Hospital, and also achieved a contract for the people who had already been there. So there has been some growth in the labor movement actually in Rhode Island, which we're very happy to report. On the legislative front, we had a mixed year, to be honest with you. Let me take the bad things first, and then I'll go with the good things. We had a tremendous victory for our brothers and sisters in the teaching profession and in the school systems, the support staff, when the legislature passed legislation for allowing for a contract to continue after it had expired. This has been a concern. We've seen Warwick, we've seen East Providence, where contracts have expired and management has implemented unilaterally changes in the working conditions. Great victory, solid victory. I want to thank the leadership of the House and Senate for that, and the members who voted with us. And then, unfortunately, Governor Raimondo vetoed that bill. That was really extremely disappointing. This has been something that the leaders in our municipal workers and teachers have been fighting for 20 years. Mm-hmm. It's sort of like, it's either that or binding arbitration, but there has to be some reasonable solution to a contract when it expires.
That doesn't seem very complicating to me.
It's not very complicated. It's very common sense. You have to have, and what happened is it's a few attorneys out in the renegade business community went to some of these school committees and said, hey, wait a minute, just keep bargaining, get to the end of the contract, and then you can implement it whatever you want. And they did it in East Providence, which was the test case. So we knew we had to do something. So that's on the agenda for next year, either the continuing contract bill that hopefully the governor would sign this time, or binding arbitration. The other disappointment for 2017 was that we were very, very hopeful that the PawSox legislation would pass and we would get that new stadium built. We would be on our way to keeping the PawSox in Rhode Island. Unfortunately, ran into some glitches, and that is on the horizon for 2018. The Senate, 2 weeks ago, or last week, put a bill out. Hasn't voted on it, and then hopefully that'll be voted on the first week of January. Now, on the positive side, January 1st of 2018, the minimum wage in Rhode Island will go from $9.60 to $10.10. That's 50 cents an hour more. I think it's important to put it in the context of nationally. The minimum wage for our country is $7.25. So our minimum wage is almost $2 more in Rhode Island than it is across the country. We're still behind Massachusetts, although our minimum wage is also, with the bill that passed, will go up to $10.50 on January 1st of 2019. We were successful in getting a bill passed and signed to create worker cooperatives, which was a very important initiative from our friends from Fuerza Laboral that hope that they can do this to maybe get some economic justice for people, particularly working in the cleaning industries and the janitorial fields. So that was pretty significant. Let me check my notes here, Jimmy. Earned sick time. Going into effect July of 2018, workers will get 3 paid sick days per year, then it goes up to 4 the following year and 5 the year after that. And a very significant bill that passed, went into effect this year, will prevent employers in the restaurant and hospitality industry from taking the check, when someone skips out on a check, which was an awful thing to do. But let's say that's $150, $200. Restaurants have been charging the wait staff that money.
They've been stealing that money.
Yeah, they've been taking it out of their pay, so that it will now be illegal. So from that perspective, we did make some progress to help workers' lives, and particularly the minimum wage, 50 cents times 40 hours, that's $20 a week. For a lot of people, that's significant.
That's great. So there's some good and some bad, but
Yep.
mostly good, especially on the organizing part, and that's how we grow.
That's how we grow.
George, when I was 18 years old back in 1968, my brother Mike and I got involved in the anti-war movement. We were opposed to the war in Vietnam, so we got involved. And the first time I'd ever really been involved in that sort of respect.
Yeah.
And we found out how important it was through that whole process, how important it was to have the right people sitting in the right chairs when people are voting, whether it's in Washington, D.C., whether it's in Providence City Hall or Foster Town Hall.
Correct.
It's important to have the kind of people there that devote themselves to the needs and concerns of working people and the kinds of issues that we care about. So do you think it's a good idea for union members to be involved in their communities?
Well, we live in a democracy, and we are very grateful that we live in a democracy, and we honor those who have fought to maintain this democracy and grow this democracy. But it doesn't work unless people participate. And I think it is the solemn obligation of every working person when they turn 18 to go register to vote and to participate in the system and to vote, but also to get involved, not just leave it at that. Run for office yourselves if you're not happy with the way things are. Help somebody who you believe is the best person for your interests. So we get criticized occasionally because they say, well, you guys have too much power. You're too involved. You can't be too involved in the democratic process. It is our obligation to those who went before us that allow us to continue to live in a democracy. So yes, the labor movement takes political action extremely seriously because we know that the decisions that are made, whether it's Washington, Smith Hill, your local council, they affect your lives. They affect the taxes you pay. They affect what rights you have, particularly public sector. Bargaining doesn't come from the national government. It comes state by state. There are a lot of states, believe it or not, in 2017, going into 2018 in the United States of America, where public sector workers, teachers, firefighters, police, don't have the right to bargain. They don't have the right to sit down with their employer and engage in collective bargaining. And that's because that legislature or that governor doesn't believe in it. So, this is who we are, and this is what we should continue to do.
What's on the horizon for 2018 in the Rhode Island labor movement?
Well, we have a number of things, some unfinished business. I would put the POSOX as unfinished business. Hopefully we can get some legislation early in 2018 to keep the time there. Secondly, we will be pursuing getting the continuation of the contract legislation or binding arbitration. We need to increase the unemployment insurance benefits for the people, the maximum benefit. So we'll have a full plate in 2018, and we'll be very involved again in all the budgetary issues to make sure that there's some fairness for nursing home workers and the people who serve the developmentally disabled. So we'll be busy.
Great. George, voters in Alabama today are choosing their next United States Senator. This has been a very important election for obvious reasons, and there's a lot of passion going into this race. But you and I, regardless of what happens tonight with the voters in Alabama, tomorrow you and I are going to feel very warm and very happy. Because George Nee, as you know, tomorrow morning, you and I have reservations on the Gingerbread Express.
We do.
Tell our friends about it.
The Gingerbread Express is just a wonderful, wonderful example of the generosity and commitment of the labor movement to children and to students to make their lives a little better. The NEA Rhode Island, one of the teacher unions, along with the run this program called the Children's Fund. And one of the things that they do is at the debate school up in the Olneyville section, they've been doing this for, I believe, over 20 years. Every single student in that school, from kindergarten to 6th grade, gets a customized, personalized bag of toys and clothing. Not just off the rack. I mean, we're talking about specialized buying. And the teachers donate the money and the time, and the Teamsters Union deliver all these gifts from the NEA headquarters over to the debate school. They do this Children's Express, this Children's Fund, and they help out students all over the year with the eyeglasses, coats, all the kind of things that would help them to continue to learn when those things become impediments. But this is a special day, and when you see 400 students sitting there on the floor, very disciplined, and with their eyes wide open, and the commitment that the teachers and the police and the fire and the Teamsters and have had to just bring a little joy and a little happiness into people's lives, it leaves you feeling there's hope in this world, and we're going to make this a better world because of activities and people like this.
That's wonderful. That's it for Labor Vision today. George, I want to thank you for coming in today. I think it was a great show, and we hope to see you next time on Labor Vision.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.